All right. All right. So hi, everyone. Thank you so much for being here today for our DoSAA South Asian Community Events Issues Series. My name is Dr. Shruti Swami, and I am the co-chair of DoSAA, which is the Division on South Asian Americans, a subdivision of the Asian American Psychological Association. I'm really excited to be here to present this specific speaker series to you all, and also just as a participant as well to hear Dr. Durvasula talk about narcissism and culture among South Asian Americans or South Asian clients experiencing narcissistic relationships. So I will let her go ahead and introduce herself and her talk. But yes, please do keep in mind that this is recorded, so we will also post it on YouTube at a later date. And if you have any questions about DoSAA or AAPA, please do let me know. And if you have any questions about the talk itself, you may go ahead and put it in the chat, and we'll do our best to monitor that. Thank you.
Thank you, Shruti. I'm Dr. Ramani Durvasula. I am was until last month a professor of psychology at California State University, Los Angeles, from where I retired. And I am a clinical psychologist. And I'm also a founder and CEO now of a company as of last January 1 of a company called Luna Education, Training and Consulting, which really focuses on doing psychoeducation, awareness, content for clients, content for therapists, content for all kinds of other settings on this issue of narcissism. And I have a YouTube channel. You can find much more of my content there if the narcissism issue is actually interesting to you. I've written some books on the topic. So I'm hoping today to, because we're a small group, people can pop in at any point. Shruti has told me that she'll be willing to monitor questions. I'd rather interrupt, and I could rather get it interrupted and us be able to address the questions that are important to you than me feel like I have an agenda and have to get through certain information. Generally, when I talk about narcissism, I will hint at intersectional issues and certainly culture. And today I hope to get to some of the very specific issues that are reflected when we're working or talking with South Asian clients, or even talking about this community, talking about this issue within the context of the larger South Asian community. And so let me talk about, in general, what narcissism is, okay? Because I think that if Shruti was saying this, even in our training, this is something that actually, interestingly, is not a highlighted topic, right? If we're lucky, we'd get an entire course on personality disorders. Most people don't. It's usually subsumed in an existing psychopathology class, if that. And then even when it happens there, it's sort of one of these strange third rail issues in the mental health community. And so it's something that just doesn't get talked about a lot or enough, whether that's in didactic training, whether it's in supervision. And so let's just sort of talk about that for a minute and talk a little bit about why is it so important that we understand this topic. I'm going to be getting to the issue in a moment of this larger issue called narcissistic abuse, which is sort of a set of psychological sequelae that occur in people who experience relationships with difficult, high conflict people, including those with narcissistic personalities. But again, today, what I want to talk about is less about narcissism per se and more about what does it do to the people around them, which is why it's important that you sort of understand what narcissism is, to understand what's sort of driving the dynamic. And when the problem, an issue we often come up with clinicians, is that it's easy to sort of gaslight the client. Are you sure? Like, did you hear that right? And this is what these folks are doing to themselves all the time, second guessing themselves because of the nature of the dynamics. And so we'll get into that. So when we hear this word, narcissistic, many of these are the terms that other people may use almost synonymously with it. Everything from sort of the kind of diffuse and obtuse word difficult to the sort of maybe not necessarily a perfect match, but psychopathic or sociopathic, or even sort of downright incorrect terms like calling someone bipolar. But you'll see that there's a whole host of terms that people will use, from the conversational, like difficult or toxic, to more clinical terms like antagonistic. So I'm hoping to create more clarity on that today. Part of the challenge is that when we look at the DSM, we tend to see the sort of the traditional diagnostic criteria, which is sort of these 9 kinds of symptoms, patterns, all sort of cloaked in this idea that it's a personality disorder, it's a pervasive pattern characterized by grandiosity, admiration seeking, lack of empathy. And then again, the symptomatology as listed in the DSM really gets at issues like grandiosity, admiration seeking, entitlement, exploitativeness, the lack of empathy, and the arrogance. However, using this narrow a lens really misses the much wider swath of patterns we observe in people with narcissistic personalities. And people often get so caught up in saying, well, you shouldn't diagnose someone you haven't met, blah, blah, blah. To call someone narcissistic is a characterization of personality. It's not a disorder per se. So much like we might use a term in the personality literature like agreeable or high-end neuroticism, narcissism is in that realm. The diagnosis of narcissistic personality disorder actually has a relatively low prevalence, depending on whose study you're looking at, anywhere between 1% to 6% in clinical populations. But the prevalence of meaningful and observable narcissistic patterns is a lot higher. We've never been able to get good numbers on that, but a lot of the estimates are somewhere around 1 in 5 or about 20%. But as you can see, this is a pattern that is quite manipulative, that is unempathic, that is very dysregulated. And as you can imagine, it brings up a lot of issues in relationships. As narcissism as a concept has developed in DSM-5, they've gotten away from that usual sort of laundry list of 5 out of 9, and now they're trying to use a model that accounts for not just the traditional grandiose conceptualization of narcissism, but also the vulnerable sort of conceptualization of narcissism, where a person feels much more victimized, and they don't, and any grandiosity is almost like a begrudging grandiosity. So I want to just sort of show you what that looks like, that difference between the vulnerable narcissism and the grandiose narcissism. Narcissism is sort of this construct that most researchers, Ronning, Sam Pincus, and other people write in this area, sort of really feel like it has a grandiose and a vulnerable element. The grandiose narcissistic pattern is what we're accustomed to hearing about. I'm great, I'm the king of the world, I'm in charge, look at me, I'm so wonderful, and tends to have more of a pretentious and arrogant kind of top note. But with the vulnerable narcissistic person, the grandiosity tends to be a bit more victimized. The world doesn't see that I deserve to be the king of the world. And what we tend to see there is more of a reactive hypersensitivity and a sense of fragility. Most theorists will argue that both of these types of narcissism co-locate in the same person, with one more prominent than the other. And the form that's being expressed at any given time would relate to what's happening to that person. So if the narcissist is having a good day, good week, good year, you're going to see very much the grandiose presentation. Look at me, I'm so great. I have a great car, I have a great life. Don't you wish you were me? But if things were to go wrong in that individual's life, you will see much more of the victimized, resentful, sullen, why is everything so unfair to me picture, and a different kind of presentation. But the existing dysregulatory themes, like, for example, reacting with anger, that will remain, or I should say more like rage, that will remain. When we look also at how the DSM is conceptualizing of narcissistic personality disorder or narcissistic personality styles in the alternative model for personality disorders that debuted in the DSM-5, all personality disorders, not just narcissism, are sort of subdivided into looking at dynamics of self and interpersonal dynamics, and then with self being divided into identity, self-direction, interpersonal within the realms of empathy and intimacy. And in general, across all of these, as you can see, the self is very much governed by how other people view the narcissistic person, that there's self-reference to other people to get a sense of identity. Self-esteem is regulated on the backs of other people. Everything is based on how the world or other people are viewing or judging or appraising the narcissistic person. They'll set goals based on what they think other people think is considered good or cool or whatever. In the interpersonal realm, empathy is deeply impaired, that there will only be an attunement to the needs of others if it's self-serving, and there's very little self-reflective capacity. And regarding intimacy, there's limited capacity for intimacy. Relationships tend to be rather shallow. They tend to serve more of a regulatory function. There's very little interest in other people's experience, and the focus of the relationship is very much on personal gain. Okay. And so when we look at the trait model that's now being forwarded by the DSM and the DSM-5, it's about putting together these traits like psychoticism or antagonism, those detachment. And depending on the personality disorder, one or more of these trait patterns are considered to be prominent. In narcissism, the trait pattern that's considered to be prominent is antagonism, very much characterized by these qualities of being manipulative and deceitful, attention-seeking, hostile, and so on and so forth. So as you could imagine, these behaviors are going to, as noted here, put a person at odds with other people. And then there's a lot of sort of callous disregard for others, this entitled expectation of special treatment. And like I said, this takes a tremendous toll on human relationships. But the word narcissism is an ugly word in the mental health world. And you often can't use it for fear of offending people. And that might not even be therapeutically. It could be in workplace consultation. It could be in, if you consult on issues related to family law. To use the word narcissism is considered mean-spirited. It's considered to be overly diagnostic if you haven't worked with someone. So I literally came up with this acronym so people could talk about the patterns inherent in narcissism without actually saying the word. And so these are styles that are high conflict. It's a rigid style with very, very little likelihood of change. Antagonistic. It's a very vulnerable, victimized style. It's entitled, it's egocentric, and dysregulated with lots of reactive emotionality, particularly anger and rage. This acronym is something that I've given to advocates, people who work in the domestic violence world, as a way to talk about these issues without using a word that, like I said, seems to be sort of a third rail in the mental health world. Are there any questions so far?
I guess, hi, I wanted to just jump in and ask, and I think it's framing what you're obviously going to be getting into, but the coexistence of things like dependency that exists within, well, I would say interdependency or dependency that's fostered in South Asian communities, arguably. And so it's just sort of getting my mind thinking.
Absolutely going to talk about it and why this has come up as such a absolutely incendiary issue in South Asian clients, in India in general. It's been remarkable how direly wanted this conversation is, and we'll try to unpack some of that. So thank you for bringing up that point, because it's really, really important. Narcissism is a style, the personality style is on a continuum. And it's important to know that because it's not an either or, somebody's narcissistic or they're not. At the milder end of it, at sort of the lower grade, we're really talking about, I mean, for lack of a better way to put it, I call it Instagram narcissism. It tends to be very superficial, self-referential, really relying on sort of shallow emotionality, really relying on sort of superficial validation. And in the absence of that, we'll see irritability. There's a sort of emotional immaturity we observe there. Is it the kind of stuff that results in sort of real toxic interpersonal interaction with others? Not really. People probably get more than anything frustrated with people on the lower end of the continuum when real life stuff happens, like raising kids or getting paperwork done. There's sort of a blithe, almost adolescent oppositionality, like, oh, I can't be bothered. And, and this could happen not just in someone who's 25, but 55. At the most severe end, we're seeing something that's much more malignant and could even be considered dangerous. More severe malignant narcissism actually resembles some of the qualities we see in psychopathy. And it's here we might even see dynamics like coercive control, a greater likelihood of violence, a greater likelihood of financial malfeasance, deceit. And so things that can actually fracture a family, can result in issues around legal issues or law enforcement issues. The mid-range is probably what the modal any client you're dealing with is most likely dealing with. At this extreme end, you're often talking about more intersections with legal and justice systems, downright violence, interacting with, for example, domestic violence advocacy systems. Down here, you're dealing with annoyance, but here you're dealing with people really grappling with something that's taking an interpersonal toll on them, but they still may not be able to get the kind of guidance they need in traditional psychotherapeutic kinds of settings. There are multiple subtypes of narcissism, and in the interest of time, because I want to remain very mindful of time, I'm not going to get into these. If anyone has questions on the specific subtypes, I'm happy to talk about them. But the traditional ones that we most often talk about are the grandiose, the vulnerable, and the malignant styles. Those tend to be the most articulated in the literature. Communal narcissism is something that was articulated around 2009 by a researcher at the University of Munich. This idea of getting your validation by doing good deeds for other people. So people see this person as a pillar of the community, but their validation is really, they're doing the good deeds, whatever it may be, raising money, giving to a religious community, any of those things to be able to get validation. Hi, Helen. I see my beautiful friend Helen's face, who I've missed. And then these other subtypes, again, instead of me boiling down our time, because I really want to get to the culture element, I'm absolutely happy to explicate these further as we get further into the presentation, especially as we talk about culture. I am putting this up here partly because it's colorful, but partly because there's a lot of research out there on how to work with individuals with narcissistic personality. And I can say one thing pretty certainly after having read most of this literature, not much works. Even when you look at this literature and how they approach narcissism, you're talking about somebody having access to therapy at least 2 times a week, usually for at least 12 to 24 months, with a highly trained therapist and a highly motivated client. That's really like a 4-planet interplanetary alignment. As a result, in most clinical situations, when you're working with somebody who may have a narcissistic spouse or parent or adult child or in-law or something like that, the odds of that person being able to access therapy and be motivated to want to engage in the therapeutic work is pretty close to 0. So the kind of movement and change we see with narcissistic clients, it's very, very, very unlikely to change. We do not see clinical trials or anything like that in this therapy work. It tends to be case reports of exceptional cases. Basically, they're writing about unicorns. I'm glad those few people made progress, but modally, it's not what happens. And in terms of realistic expectations for your clients, I think that's really important to be aware of as a clinician. So I'm going to say a little about this issue of gaslighting, because I'm going to use this word, and I think it is like sort of the word du jour of the year 2021 or maybe the year 2020. I want to make sure everyone's using it right, because if nothing else, if all you get out of this is the concept of gaslighting, then great. But gaslighting, the title actually derives from a 1944 film, but it was a film with Ingrid Bergman and Charles Boyer. I highly recommend you watch it. For how old-fashioned and black and white it is I think they'd struggle to make a movie that good now. And I think we've seen some, but this one hit it out of the park. That's where the term actually came from, the play and then the subsequent film. So it's we're going to think about it as a term in the language. It came from that. And the therapy world probably started uptaking it in around the 60s or 70s. And we still don't learn about it in graduate school. But gaslighting is a form of interpersonal manipulation. It's the intentional denial of the reality of another person. Most people would agree that gaslighting, especially chronic gaslighting, qualifies as a form of emotional abuse. And if a person was raised in a narcissistic family system, it started in childhood, which really, really leads to a lot of anxiety and self-doubt in the child as they come into adulthood. Gaslighting is a grooming process. It is not a one-off. Like typically strangers can't do a very good job of gaslighting you because you don't trust them. Gaslighting, the grooming process, is predicated on trust. The idea that the gaslighter in your life, who you may not know is a gaslighter, has some form of expertise or authority, but above all, trust. You either want to trust them or you already do trust them. And as a result, you accept their distortions of your reality and are willing to take them in and not push back because of that need for trust. Gaslighting happens over time, and over time, what ends up happening is a person who's gaslighted feels confused, feels completely riddled with self-doubt, and can sometimes believe that they are mentally ill. The gaslighter's goal is to get it to appear to the world that they have full consent from the other person, that the other person, it's not just capitulation, but that they're in full and active agreement with the gaslighter. Okay, and that it looks like agreement to the world, which often it does. The person's nodding their head and saying, yes, we're on the same page, but they kind of have that gauzy look of someone who's in a cult. Examples of language that's gaslighty is things like you're too sensitive, or you have no right to feel that way, or you're crazy, there must be something wrong with you, or I never did that, I never said that, that never happened. And your clients who are being gaslighted, they will come, they will tell you situations of how they'll say, I showed them the text. There was the text. It was right there. And when they showed the gaslighting partner the text, instead of the partner saying, oh my gosh, you're right, I'm so sorry, they will then dissemble the person saying, are you really that petty a person? You're so petty and you're so small-minded. You feel the need to go and show me your phone. You disgust me. There's something wrong with you. So you see what's happened there. Now, even though there's burden of proof that the person was gaslighted, the gaslighter has pathologized the person for bringing this sort of evidentiary base. And that's what these relationships are about. People feeling they need to bring an evidentiary base for their feelings and for their reality. Gaslighting, for example, in the movie, tends to be an individual phenomenon, but it can happen by other people. For example, a mother saying about a father, oh, your father doesn't mean that. You're being too sensitive about your father. So now another person, it's like a third party doing the gaslighting work, which can often calcify that because they're saying, well, if two people believe this, or maybe other members of a family, gaslighting, as I say, by tribe or collective gaslighting. But we also have to account for institutional and societal gaslighting. For example, the foundation of all hegemonic and systemic abuses, racism, genderism, all biases against communities, all communities of color and LGBTQ plus communities, that's societal gaslighting, saying things like, there's no racism, everybody can get ahead if they just work hard. Gaslighting. And what does it do? Instead of leaving one person feeling like they're losing their mind, it leaves entire swaths of society feeling like they're losing their mind. So this dynamic is critical to understand because some of your clients may be experiencing all of these forms of gaslighting simultaneously, thus destabilizing them even further. Another challenge with narcissism is that there's a lot of overlap with other sorts of conditions. So people who are narcissistic will also often present alongside, or sometimes substitution terminology will be used, including ADHD. There's a lot of co-occurring addiction. Impulsivity is a key characteristic of narcissistic personalities. Social anxiety is a key piece of vulnerable narcissism. It's very common for vulnerable narcissistic people to look like they have an irritable depression. Clinicians will spend months, 3 months, 4 months, get them on meds, everything, and say, why isn't anything changing? Because it's likely not primarily a mood issue. Hypomania, obsessive compulsive patterns, intermittent explosive stuff, oppositional stuff, all of that can co-locate or be often that term will be substituted for narcissism, which can be even more confusing for people who are enduring it. So then the bigger question is, what does this do? If a person is in a relationship with somebody who has these narcissistic patterns, what does this do to the survivors? It's not good. That's sort of the short answer I'm going to give you. And some of you may have worked with clients in this situation. And this now takes us into this concept of something called narcissistic abuse. It's a tough one because this is not a term, unlike even like CPTSD, that has gotten some uptake in mainstream communities. This term is not fully there. Yet you're going to have more and more and more clients, if you're working clinically, who are going to come to you and say, hey, do you work in the area of narcissistic abuse? You're going to be like, huh? I don't know what that is. I didn't learn about that school. I don't see it in the DSM. Whether we like it or not, this is the new world of mental health. It's a thing. And because it's a thing, I think it's a responsibility of clinicians to understand it. This is a problematic term. It's a term that people have been bouncing about for like 10 to 15 years because it makes a presumption. A lot of clinicians don't like it because it's making a presumption about the personality style of someone else who's not in the room. So a person will say, I'm experiencing narcissistic abuse from my mother. I'm experiencing narcissistic abuse from my spouse or my partner. I'm experiencing narcissistic abuse from my adult child. You will probably never see the spouse, the child, or the parent. So a presumption is being made about that person based on their conduct. And there has to almost be sort of a humanistic suspension of disbelief and a willingness to hear why is the client using this term? So here's where it gets tricky, because most of us were trained to focus on the person in the room, right? Our focus is the client. We're not going to talk about all these antagonistic patterns. Let's stay focused on you. The problem is the thing that is causing them so much pain is the manipulation, the lack of empathy, the denial of experience, the invalidation, the gaslighting. That's what the issue is. And so we need to understand this. And it really begs the question, can we help them without understanding narcissism? And I think the answer is no. When I talk to clinical audiences, I'd say if it helps you feel better, and I think it probably could help a lot of us sort of digest this term better, instead of using the term narcissistic abuse, to consider using a term I've been saying is antagonistic relational stress. We can even take away the syndrome, because syndrome feels like such a pathology, but just call it antagonistic relational stress. I think by calling it that, we acknowledge that somebody who's in a relationship with somebody who has antagonistic relational behaviors like manipulation, exploitation, and all these other things, it keeps it in line with the DSM terminology. It focuses more on behavior than having to be an indictment of the other person's personality, which we can't do definitively if we don't have them there. And it still allows us, though, to do the kind of work we need to do with these clients, because we are coming up short with these clients. And in a moment, I'm going to switch gears to why this is such a critical issue in South Asian communities and populations, both in and outside of the United States. We were trained to never talk about the people outside of the room, to not infer things about them. Well, I'm a big fan of subjective reality, and that's where I meet my clients. I'm very much a Rogerian humanist, so it works for me to fully believe them. We also are told not to infer the motivation of another person. So somebody, I don't know, engaging in repeated sins of omission, we can't infer that they're actually trying to hurt their partner. We have to say, well, they keep having sins of omission, right? So it's that need to sort of stick to this very behavioral terminology, which the client is so confused by, because there's so many of these confusing things happening in their world. Here's the biggest issue, though. The challenge for me has and always been, and I think a lot of this does relate to gender repressions and hegemonic stances towards women or female identified individuals, is we tend to pathologize and diagnose those who are experiencing the relational abuse. I don't like the word victim. I'm going to use it for shorthand here, but let's just pathologize the victim, and then we can all just keep walking and not think about this. In a recent literature search I did in the domestic violence literature, pulled 100 recent articles. Of those 100 articles, they were all, I was looking for treatment literature. 90% of them were on how can we clinically work with the perpetrators. And I'm thinking, number one, I would say almost 100% of domestic violence perpetrators have significant narcissistic pathology. And the reason the domestic violence world has struggled with this for so long is they're like, can we please stop talking about this? Because that implies there's an illness that can be treated. In my work in the DV and IPV community, I say, what if I told you that this can't be treated? So I'm giving you a framework for why it won't change. But the fact of the matter is we have this obsessive zeal to figure out how to work with the perpetrators. Very little of that research shows much long-term utility or sustainability. And the little work there is out there on survivor work tends to focus more on psychosocial issues like housing, financial supports, but very little on the psychology, on shoring them up and educating them on what just happened to them. It's a huge, huge hole in this particular literature, which still perplexes me on what our unwillingness is. It's almost as though there is an unwillingness to call out the patriarchy and that a therapeutic model would be permitted to do that. So there are also issues around culture, which I'm going to get into, but we also don't address. Our therapy models do not address structural and systemic issues. And there are people who know a heck of a lot more about me, about me than I do, than me, that are talking about decolonizing therapy and decolonizing models of psychology. A lot of that has to do, it's the individual, it's an internal process. Let's look at their central nervous system. That's all great to do. But even my brain lives in a context. And if we cannot look at structural and systemic issues, we cannot understand this phenomenon of narcissistic abuse, antagonistic relational stress, call it what you want, but we're not trained in this. Personality disorders are the thing that bring clinicians to their knees, and yet most programs don't have a one full semester course on personality disorders. And what they should have is a full semester course on the high conflict personality disorders like narcissistic, borderline, antisocial. Nobody does. And when they do, they tend to go full neuroscience on it. And that's all great, but I got to tell you, nucleus accumbens, when I got a client screaming at me, not so interested in your nucleus accumbens, I need you to stop screaming at me. Okay, so that is also, it's a real hole in the disconnect between what's happening pedagogically and what's happening in the room. Okay, so I'm going to jump a little bit around a little bit because I really want to get to the culture piece, and I'm very mindful of the time. I often tell people, you want to, if giving you another acronym, we went from craved to dimmed. In other words, we've dimmed this person's life. These are the dynamics that present in narcissistic relationships. A person who's in a narcissistic relationship has chronic experiences of being devalued, invalidated, minimized, manipulated, mostly gaslighted, experiencing the chronic exposure to entitlement. Basically, it's their world and we're just living in it. And dismissiveness, and I'd also argue dysregulation. Lots of dysregulated anger, very reactive rage. This framework really helps us understand pretty much on the daily what happens to most clients who are in these kinds of relationships, okay? When we look in total at what is happening to the modal survivor of narcissistic abuse, this tends to be how the symptomatology kind of lays out. The cognitive symptomatology tends to relate to things like lots of rumination and regret, euphoric recall that can make a person vulnerable to consistently returning to these relationships, causing even more chaos in the system, helplessness, powerlessness, confusion, which is probably one of the prime patterns, I should say, that we'd see in someone experiencing narcissistic abuse, perfectionism. If I get it just right, then maybe they won't be mad at me, and lots of guilt and shame. Experientially and interpersonally, we see a lot of loneliness, people feeling like nobody gets this. Maybe I'm the only one going through this. Maybe there's something wrong with me. Lots of difficulties with trust, even after a relationship ends, and a lot of isolation, especially in the more severe narcissistic relationships where there may be sort of coercive control dynamics. We'll even see perceptual and arousal related symptomatology, like we might see in a post-traumatic stress picture, like flashbacks and re-experiencing if there was more severe abuse within the relationship, lots of hypervigilance, lots of hyperarousal, and lots of difficulties concentrating, often related to that rumination. Disruptions in self and identity, things like a fear of being alone. And when I say fear of being alone, I don't mean like in a room alone. Like I mean in the long term, that there's afraid they'll end up alone if they leave the relationship. Lots of self-doubt, lots of self-devaluation, and probably the most damning quality is the self-blame. This is my fault. I must have said something. I must have done something. There are some good days, but the self-blame also gives the survivor some sense of control. The emotional affective symptomatology, I know Helen was on a talk once when I called these A-Town. A-Town is the anxiety, apathy, amotivation, anergia, anhedonia, and I would add anger to that list too. All of these negative emotional symptoms, that means that a lot of times when these folks end up in a therapist's office, they're almost immediately diagnosed with a mood disorder or an anxiety disorder and treated as such. The challenge with that is that then the actual antagonistic relational issue is not addressed. And the person is in essence pathologized, being said, you have a mood disorder, you have an anxiety disorder, versus you're actually having a relatively normal reaction to this kind of a relationship. And then a whole host of physical and health symptoms, including sleep problems, exacerbation of existing physical health issues, deficits in self-care like medication adherence, getting regular health exams, like just a sort of a self-devaluation, fatigue, exhaustion, and of course, maladaptive coping. I'm going to jump to culture so we can get to that, so we have some time for questions. Because why are we then focusing on this in a presentation where we're talking about the South Asian community? So to give you some background to this, I have been working with South Asian clients. I have spoken in in India. I was supposed to speak in Pakistan. They pulled my visa at the last minute, which is really interesting because once it was found out what I was going to be speaking about, there was a whole brouhaha, and then the whole thing got 86ed at the 11th hour, which I found actually quite interesting. I have consulted with folks in Kuwait and all of the Gulf states. So South Asia and the Middle East, this is an issue. People, when I did this presentation in India, it was standing room only, and it went 2.5 hours over, and I think we would have ended up being there all night. The community of folks who care about this in India is so robust, and I don't think it's because I'm South Asian. I really don't. I really think it's the issue. And so, in fact, they had printed a version of my book only for distribution in India, and it was just selling out. Again, I don't think it's because it's a great book. I think that there's a dire need for this content there. Why is this important to understand in India? Why is it the case that in South Asia, India, all parts of South Asia, there's such an interest in this? Narcissism as a quality, as a personality trait, is likely to be more prevalent and even cultivated in cultures that are characterized by oftentimes very ancient patterns like patriarchy and paternalism, authoritarianism, deeply socially stratified cultures with little ability to move between those levels, like a sort of a destiny that's created by one sort of social group membership. Economic inequality that's very visible, proximate, almost in your face, and chronic historical oppression of subgroups based on any number of characteristics or roles that an individual takes, and that these things are very calcified in the culture in a way that they're sort of generationally transmitted. Narcissistic personality, though, can also be a byproduct of trauma. We know that developmentally, there's etiologically a relationship. So as a result, we may actually see a greater prevalence of narcissism in culture that have been impacted by collective trauma, such as war, chronic civil unrest, forced migration, and genocide, as well as regions of the world that have faced long-term scourges of colonialism and colonial placement. Even if the colonial rule has left, we know that that can often quite, if not permanently, scar a culture for a very, very long time and impact its identity and the identity of the people within it. It can be enabled by family members, and it can even be magnified in collective structures. We always think, there's something so protective of collectivist structures. Not so fast. When it comes to this issue around narcissism, in the collectivist cultures, there can also be a tendency, if someone in the family is behaving in a manipulative, oppressive, bullying, cruel, unempathic manner, for the family to close ranks and say, shh, let's not say anything, we all need to get along, leaving the people who are most scapegoated by that dynamic with nowhere to turn. And there's a massive amount of cognitive dissonance that's raised by narcissism. Cognitive dissonance, as you all remember when you learned about it in intro psych, around Festinger's work and the fox and the grapes and all of that. That cognitive dissonance is this idea that the human mind does not tolerate inconsistency well. So we tell ourselves what we need to tell ourselves to make the pieces fit. Well, that cognitive dissonance is a major player in what makes narcissistic relationships so sticky, because people will justify the behavior of the difficult person. This is how they were raised. They don't really mean it. We do have enough good days. And before you know it, a person's justifying everything away. And this ends up becoming a bit more of an intergenerational issue. Family loyalty is a complicated one. As we know, in South Asia, family has a tremendous primacy, right? Well, this fostering of family loyalty or family first can unfortunately have a problematic side, which is the enabling of narcissistic patterns. And it's interesting how much more supported the high conflict person is by this kind of thinking than oftentimes the person who is most being harmed by exposure to these patterns. It also can foster a greater likelihood of intergenerational transmission, not simply of narcissistic generation after generation, but more that being raised in light of this can result in significant amounts of anxiety, for a child who's raised like this as they go into adulthood. And if it may not be the narcissism per se that's being intergenerationally transmitted, it can be the narratives that come out of narcissistic family systems, such as I'm not good enough, a doubt in one's own emotional world, a second guessing, a constant sense of self-doubt. And that patterning can be intergenerationally transmitted. There's a tremendous amount of helplessness that these patterns bring up, and that helplessness can be magnified if there's a sense that a family system will not be supportive. There can be a greater tendency to pathologize those who are the survivors of these patterns or scapegoated by these patterns, rather than the people who are behaving in a narcissistic manner, in part due to those patterns I just talked about, like the patriarchal, hierarchical, top-down ways of running a family, that it would be that the person who's sort of lower in the hierarchy is making noise because they're being mistreated by someone higher in the hierarchy is more likely to be the one that's pathologized, rather than the problematic behavior of somebody higher in the hierarchy who is behaving in that manner. And then above all else, any of you who have worked in these communities know then there's an unwillingness, there's almost a disloyalty if these issues are brought into therapy. And I have to tell you, when I've worked with South Asian clients, it can take weeks or even months before there's a willingness to really express negative feelings, negative thoughts, negative emotionality around family of origin issues. And then there's a lot of gaslighting language that happens in light of this enabling. Oh, that's just how your father is. Stop exaggerating. It's not so bad. Stop complaining. You need to learn to put up in the prior generations. You have it so much better. You know, and that kind of ideation is a form of gaslighting, leaving people silenced, emotionally suppressed, and feeling as though they cannot talk about this issue they're experiencing. Now, in working with South Asian clients and families and couples on these issues, there are certain things that are culturally sort of part of family structures, things that impact mental health, that also raise the importance of addressing these patterns around narcissism. The unique role of the in-law in the South Asian family. It especially for, and this is where consultation becomes important for those who may not be as familiar with these kinds of structures. The historical, almost ancestral anticipation around in-law issues, and this almost like anticipatory abuse that one expects, and then when it happens, like this is how it's always been, that there can be some very nuanced dynamics around that. That, you know, it's something, because I know Helen's on the call, we have talked about, for example, in South Asian students who are in the United States, the incredible psychological pressure around academic success and the attendant mental health fallout from that. There is a high achievement orientation and an externalized locus of control and orientation, especially many times in immigrant families who really are expecting the best grades, the best achievements, the best placements in universities and schools, to the point where there's very little nurturing of the emotional world of the child or adolescents, and much more focused on this performative issue, which can really result in mental health issues that can be almost catastrophic, such as suicidal thoughts and behavior in adolescents and college age students. But if not that, a lot of struggles with depression, anxiety, self-esteem, substance use, all of those things sort of culminating in this chronic achievement orientation. In South Asian culture, there still remains, after all this time, stigma around divorce and stigma about not being married. And so those stigmas are such that it may mean that if somebody's in a relationship, marriage, that is characterized by these narcissistic patterns, a person may feel there's nothing that can be done because the stigma over divorce feels even more perilous to them compared to staying in this really unhealthy relationship. There are also longstanding stigmas around uptake and utilization of mental health services, therapy, or having mental health issues in a family. There's biases around LGBTQ plus family members. Those of you who know about India know that was only, I think, in 2018, where the laws against LGBTQ plus sort of endorsing publicly that identity was against the law. And so these are cultures that are only now just changing the laws, but that doesn't mean the biases have shifted. There's many role expectations as a function of gender. So especially women are in the role of being expected to be caregiver, daughter-in-law, wife, mother, and professional. And in many South Asian women I have worked with therapeutically who also were struggling with narcissistic marriage and sometimes also with narcissistic in-laws, the absolutely overwhelming sense of the role expectations in light of this difficult relationship has really raised significant mental health issues for people who are finding themselves in these complex situations. And then there are the fading kinds of echoes of sort of old ideation that, depending on acculturative and assimilative status and all of that, things like differential gender valuation. While in India, we see this to be more pronounced, the preference of sons over daughters, we don't tend to see that as much in people of higher social class who have that, who can render more opportunities for daughters, don't view daughters as a financial liability, which is a huge part of that origin, and obviously existing gender oppressions. But it's the differential gender valuation can actually be something that fosters this narcissistic abuse dynamic because of a devaluation. Expectations of masculinized roles that a son will take. To give you a sense, and any of you who practice a Hindu faith know that the funereal traditions that are done for a parent are supposed to be done by the eldest son, and if there's no eldest son available, by whoever is the next significant eldest male relative. I almost came to blows with family members. My parents are still alive and healthy enough, but I had gone to a family funeral back in April. And they're already like, when your parent passes, I said, it'll be me. And it'll be hard. I have to find a priest that'll practice those last rites with the daughter but that's a fight. And I have to be as unhinged as I am to take that fight. That's not going to happen in all family systems. But these kinds of longstanding expectations actually become fertile ground for these narcissistic dynamics and narcissistic abuse dynamics. Again, the expectations of later in life caregiving roles, which traditionally were often presumptively heaped onto male children and their presumed wives. Again, all of this is in a heteronormative paradigm, but it's that's not always the case anymore. But if for a parent it was, I have a son, I'm going to be fine. And then there's expectations around how, for example, a daughter-in-law will function in that system too. And then it comes down to if you're a clinician or even a consultant working in these spaces, all of us need to be constantly aware of how colonization plays a role in our psychological models and in our therapeutic models. And we have to be aware of all that when we work in these varied communities. We have to avoid the quick and dirty blanket statements. Oh, he's the eldest son, he must be the crown prince. Maybe, but it's our job to take the history to find out what actually is happening with this eldest son, instead of taking that sort of knee-jerk reaction. Oh, the eldest son of an Indian family is always the crown prince. It's not true. We wouldn't do that with any other group. We'd have to be aware of that for our own group. And any group we talk to is, talk to me, tell me about this family structure. South Asian cultures are extraordinarily heterogeneous. We know this, so this is something that has plagued all the research and clinical practice with all South Asian and East Asian cultures. Asia's as diverse a place as it comes. We even know that, for example, within mainland China, the deep diversity that exists there. While in South Asia, you're talking about so much heterogeneity around religion, social class, issues around diaspora, generational status, obviously, acculturation and assimilation, if you're working in the United States or the UK. We can't assume all of us who bring lived experience, obviously, as South Asian people working in these communities. We always have to be aware of the risk of presumptive knowledge. We always got to start clean. Yes, many clients come to me specifically because I'm South Asian, and I say, thanks, great, but you still got to give me your story. And then they'll say, yeah, and then someone else will say, yeah, no, I know. Right. So I can understand that comfort. And all of us who are South Asian will know that sometimes we'll even fall into cultural nonverbals that I would never shake my head side to side in agreement with a non-South Asian client. It happens almost at a visceral, like a collective Jungian unconscious level. So, I mean, those things happen and they're a beautiful part of that dance. But when it comes informationally, we have to be aware that we don't always know, that families are different, very, very different regionally or even within the same state, depending on where a family originates from in South Asia. And also our clients' presumptions that somehow we know everything about everyone in South Asia is not true. And we need to let them know, I don't know what that is. Can you explain that to me? And then we have to be realistic. You can't go in with a narrative like, I want you out of this oppressive marriage. Not so much. It may very well be that you listen to them and you come to find out that, yeah, there's narcissistic abuse happening. Yeah, it's tough. Maybe not be the marriage you want to be in, but they will not get divorced. And then the work really comes around, and we won't get the time to talk about this today. How do you help them stay in that marriage and not lose themselves? So that's a whole nother talk, which we could have at another time. But I want to stop here, just at least give us like 5 to 6 minutes for questions. I'm going to stop my share and say, are there any questions?
So we have, a few questions that popped up in the chat. So I can, I'll start with the one that I see first over here. So I have one of, how do people deal with cognitive dissonance of dating a narcissist and flashbacks?
It's a great question. So with cognitive dissonance, sometimes it's as simple as, what would the sentence feel like if I said it with an and instead of a but, right? So it would be, the classical way I'll say it is like, I met this person, we have a lot in common, we have common interests, they're interested in getting married, I'm interested in getting married, and they yell at me a lot and they humiliate me in public and they devalue my goals. So when you say it with an and, do you see how much more powerful that is? Because then you're like, whoa. What will happen is you can't allow the but to happen. And the but is, but they don't really mean it, or but that's how their mother always talked to them. But they're really stressed because, I don't know, they're in residency or they're trying to, they're in the first year of a startup company or something. The but's the problem. I always say with cognitive dissonance, learn to hang out with that and without the but and see where that gets you. Number one, it's to pay attention to your justifications. What are you justifying? What narratives are you working through? Because again, a lot of this relates to the concept of trauma bonding, that sense of staying in a situation that's incredibly unhealthy for you due to almost reproducing a lot of characteristics from a prior relationship. It ends up becoming a bit of a working through, and there's a lot of justification. Around the issue of flashbacks, and we have flashbacks when we have a traumatic memory. So I would often say for anyone who's in a, who's coming out of a narcissistic relationship or is in one and is having these sorts of experiences, trauma-informed therapy, ideally with someone who also understands narcissism, is the sweet spot, because you'll have someone who will validate your experience, who won't say things like, well, are you sure you said that clearly? No. Of course they said it clearly. They said it clearly 1,000 times, and it took them that many times before they ended up in your office. Yeah, they said it clearly. But to also be able to do some of that trauma work, because those flashbacks may not be entirely related to the relationship. They may have origins that relate to earlier traumatic experiences, and therapeutic work can help a person understand the bridge between those two, which can also help people understand what is strengthening that concept of dissonance and those trauma bonds.
Great, thank you. So another question we have is, so one person wrote, I had parents that were influenced by negative influences of others. How do you deal with the social influences of narcissists on families? And then a kind of related question from someone else of, how do you recommend obtaining resources when dealing with some of these multi-generational power and control issues?
Yeah, it's a tough one, because I'll start with what you shouldn't do. Okay, which is, you never want to roll up into the family get together and say, I went to a talk and I watched a video. I just want to let you know, grandma's narcissistic. Probably not the play at your next family function. I think that it's very much that, let's say, for example, this person asking a question about their own parents. They may feel that their parents are actually internalizing statements and invalidations about their parents that are not true. In fact, they're being protective of their own parents, right? That they see someone else is having a really negative, invalidating influence on them. One step is to actually shore up your parent and say, you know, I know you've been getting this messaging from this other person that's not always validating. I want to tell you, as your child, my experience has been quite different. You've been wonderful. You've been you know what I'm saying? Like, you become a corrective voice instead of trying to educate them, which is a lot harder to do culturally, on the toxic influence of another family member. Your conversation may be better in a way to break the dissonance, because we often don't go up to our parents and say, by the way, you're fantastic. You know, you did good. If they did, I mean, if they didn't, I don't want you to sell them a false bill of goods. But if you, and we don't, that's not what we do as even adult children. But if you notice that kind of discourse happening, even taking your parent aside and saying, you know, I noticed something happening here. Any of us on this call is a professional in the field of mental health or psychology, and say, I notice what they're saying to you. And I'm going to say I'm a little uncomfortable because I don't agree with what was being said. So you become the frame of reference. I actually feel that you've been this, you've been great, you've been whatever, you know, whatever the affirmative on that is, because at a minimum, you may break the gaslight that's being created by that malignant person and shore them up in a different way, rather than trying to educate them about the problem with someone else, which culturally is not going to fit as well. That would be an important place to start when you're dealing with this intergenerationally. I know I can speak first person, and with families I've dealt with, I would work with the client on how to find alternate ways of how to communicate in these complex systems that aren't about speaking disrespectfully, but rather strengthening the bonds that actually worked. What that also does is it breaks out of the cycle of triangulation, where the more malignant actors in a family system can take advantage of that. If all the healthy people start to coalesce and have each other's back, it can actually disempower the difficult person that's often trying to sow chaos in amongst the people in a family system.
Yeah, I really appreciate that answer, especially the I statement kind of thing of putting yourself as a frame of reference in a situation like that. Okay, so then this is another question. So and I also realized that it is the end of time. Do you have a few minutes to stay past? Okay,
I can go a few minutes over, yeah, but I also am mindful of everyone else's time, especially those in other time zones. It's getting late, so yeah.
Absolutely. So if those of you, if you would like to stay for longer, you can. We'll be on for a few more minutes, but if you do have to leave, we really appreciate you being here for this talk. So the other question we have is kind of peeling it back a little bit of, would you say that individuals high on narcissism make more negative and biased attributions about others as compared to the average individual who is not high on narcissism?
Yeah, so that's definitely been confirmed by the research, and any research that has looked at attribution bias in people with these personality styles have pretty consistently revealed a consistent a hostile attribution bias. They've not only seen that in narcissistic personality, but also in borderline personality, which, as you can imagine, wreaks this constant set of threat in the narcissistic person's environment, because they're viewing everyone's motivations and behavior through a more, almost like a perception of malevolence. And so as a result, there's more likely to be very quick, angry reactions. And again, there's a lot of research that upholds this. So it's absolutely true. And when somebody with a narcissistic personality actually gets into therapy and stays in therapy, some of the work of the therapist is to help them to sort of unbraid and deconstruct social situations and help them and sort of educate them on more appropriate perception of threat, as it were, instead of the hostile attribution bias, which is a very, very classical chronic attribution that people with narcissistic personality styles hold, is everyone's out to get me. And so to help them understand, there may be some situations where that's true, but to pull back from that, it's not easy to do. It's really, really not. It's one of the hardest parts of treatment, but it's definitely an issue. It's so, as the person asked the questions, yeah, the answer to that is yes.
Okay. And then the other part to that question, which it sounds like you kind of answered here and in the course of your presentation, was so this person was wondering if and how those negative attributions impact how parents view their children and the parent-child relationship.
That's a fantastic question. What a great question. Yes. One of the most difficult elements of a narcissistic individual being a parent is that the child is viewed as a deliverer of narcissistic supply. The child is very much put in a role of validating the patient, which is not how the paradigm is supposed to be. So when the child is not delivering exactly what the parent wants, whatever that looks like, it could be school achievement, it could be behavior, it could be cleanliness in the home, it could be even appearance or athletic prowess or whatever it is the parent is holding out for. They will actually almost view that as the child is somehow somewhat malevolent and will hold this very antagonistic sense towards the child. Now, the child doesn't have the ability to understand attribution theory. What they're experiencing is, I'm not enough because I didn't make straight A's. I'm not enough because I didn't get into the advanced science class. I'm not enough because I didn't get the best position in whatever, the symphony or whatever it is. You know, I'm not enough. And so that's what gets communicated, because really the parent almost experiences it as a direct affront because they're so poorly differentiated from the child.
Yeah, that's a lot to digest on my end. Even I, obviously not saying that my own parents have, have narcissistic personality disorder or not, but just thinking just generally about like, what are the messages that we get from our parents, along with some of the intergenerational stuff that you were talking about, and how does that impact just the way that we as children see ourselves and go forward as well. So.
And there's also a larger cultural issue here. In any communities where there was migration, again, a place like South Asia, education and those kinds of external orientations were viewed as the only path forward, right? So there was a certain level of survivalism there. It wasn't just, I want my child to be a performing pony. It was, I want you to be able to eat. But there is a way to value education and achievement without at the same time devaluing your child, to be able to see the child in a whole way. And I understand that's an evolution. It really is. And this is some of the difficulties around assimilation and acculturation and those transitions, especially where families that migrated left rather collective, large, sort of extended family networks to come to these nuclear family networks, which is not traditionally how family and parenting was done in that culture. So even that would put a burden on that system that it wasn't ready to take. So I would say this, every demanding South Asian parent is by no means narcissistic. You really have to account for these other antagonistic, like I said, manipulative, invalidating, unempathic kinds of dynamics. The idea, the communication that school is very important, that in and of itself is, there's nothing that I would not call that narcissistic, no. Or we're all in trouble.
Yeah, that's a good point, and also a good framework to have of just like, yeah, not every single interaction is going to be narcissistic necessarily from a pathology standpoint. So the last question that I see in the chat is, in a research study, how would you measure narcissistic abuse or emotional abuse, and are there self-report questionnaires that would measure these things?
Well, if you could hold on a little longer, I've developed a scale which we're attempting to get IRB approval to validate. So we've established a scale. We haven't tested it. And basically it's a compilation of talking to hundreds of clients, clinicians from around the world, putting the list together. A lot of them overlap with a lot of them overlap with items you might see on a PTSD scale, even on a conflict tactics scale, right? Because they have the similar top notes. So we're trying to establish is this discriminant validity, that this is sort of a standalone. But so you can hang on to your hat, or I could share you what's been done. I mean, if you want to use it as an untested instrument, I'd be happy to share it with you, but that's where we're at with that.
Okay. Awesome. Thank you so much for sharing and for staying on. Okay, so everyone else, thank you all for being here. Dr. Durvasula, if you don't mind staying on for a minute after everyone leaves, we'd love to just take a picture, but thank you to everyone else for being here. Just keep an eye out for more emails if you're a part of the DoSAA listserv, for the YouTube link to this event if you'd like to share it with other people. And we'll also be having another event in November. So thank you all for attending.